All right, everyone, we're at the top of the hour and we're going to get started. Thank you all for being here. We appreciate it. Thank you for being here for our second town hall. What will your camp require for COVID-19? This is our medical director to medical director session. We're very excited. We have a very prestigious panel joining us tonight. I'm just going to mute everybody so that everyone can hear me. All right, so everyone's muted. So speakers, when you're ready to speak, you can just unmute yourselves. So we're covering coast to coast in America tonight with our speakers. We are joined by Dr. Mark Atlas from the Sunrise Association, multiple locations, but largely on the East Coast. We have Susie Burke, medical director at Camp One Step in Chicago. And we have Corey Hepner from Camp Good Times in Seattle. So without further ado, I'm going to turn it over to our board president, Dr. Kay Wagner, and she's joined by Tammy Jenkins tonight. Dr. Kay?
Hey everyone, thank you so much for joining us. And thank you especially to our panelists for being able to come on and give us some insights about what it was like to do their camps last year. I'm gonna let them start off by telling us a little bit about what their camp sessions were like last year, and then we will dive into some questions. So Dr. Atlas, if you would kick us off, please.
Our camp sessions, we run 6-week day camps that go through most of the summer. And our sessions, they weren't all that different, except we really tried to minimize indoor time. And we had to, unfortunately, there were some really inclement weather days that we didn't have the capacity to take all of our children in some of our larger camps. But other than that, the programming was really extremely similar. And, we had certain challenges as far as social distancing. We have our roundup in the morning where we have all these bleachers filled with children, and at one point they're saying, do we have enough space to do everybody together? Can we do it separately? And they did them separately, and the kids hated it, and the counselors hated it. And it was one of those times when you need to just go in and say, look, we can do this safely the way we were doing it before. And we really we made things work. And I anticipating, I think your first question, Kay, was what I learned most from last year was that we can do it, and we can do it safely.
Wonderful, thank you. How about Susie?
Hello, everybody. It's great to be here with you tonight. So we actually normally have about 10 programs throughout the year. And since COVID started, we've had basically one in-person program, and it was last July. Typically, our traditional summer camp is 2 one-week sessions, and we elected to be a little conservative. We wanted to get back in person, but we weren't sure that we were ready to run the 250 kids over the 2-week period last year. So we actually ran 2 very short sessions, and we did a week of virtual, and then we followed it with 2 3-day sessions where the kids got to at least come back together and connect. But we also reduced our risk potentially of COVID because we didn't have the kids there as long. We also weren't sure that we were going to be able to get enough staff last year. And to be honest with you, we ended up having just enough staff to run our 2 3-day sessions, so our 1 week of programming. We I would have to say that we were conservative in our approach. Maybe not conservative that we got back together, but conservative in what we did. We did feel very comfortable with the layered strategy approach, and we tried to implement all of the strategies that were recommended through the ACA field guide, the CDC, et cetera. So we did testing, we did screening, we did the cohorts, et cetera, and it really worked quite well. A lot of times at our summer camp program, we have many camps, groups of kids that go off campus to do camping trips or excursions to the city or whatever it may be. And last year we did keep everybody on campus, but we filled their time well. They had a wonderful time. There were lots of smiles and lots of laughter. And I think just being back together, regardless of the length of time, I think was a very positive experience for everybody.
Thank you. And Corey.
Yeah, hi everybody. Like Susie, our camp was set up to be 2 one-week camps, 125 kids with siblings prior to COVID. And last year, what we did was kind of hybrid. So we did some virtual, very innovative virtual camps, which, as everybody knows, much like the meeting that we're having right now, works for what it needs to be, but very unsatisfactory generally. So the kids appreciated it for the virtual part of it, but then we did, for the other part of the hybrid, we did what we called family camp. So what we basically did is we potted, we had 3 different sessions and we potted families together. Anybody who was indoors was only in their family unit. And then we would partner up, we called it the Great Experiment. And so we had fun outdoor games that we did, that we had, everybody had to wear masks and we were in kind of proximity, but nowhere indoors. We had all our meals delivered outside and it was picnic style within the families. And then we had like divided amongst the pods. For the last night, we only did weekend camps. So people would show up on Friday night and then leave on Sunday. And then for the Friday nights, we did just a big blow up outdoor movie where everybody stayed outdoors in their pods. And it was sort of a, adjacent group event. So that was kind of what we did last year with it. We didn't sort of run through as much of the, so because we were keeping everybody separate, we didn't do as much of sort of the testing and the vaccines and those kind of things. We just focused on kind of keeping everybody in their pod. And then if people didn't feel comfortable coming, and we didn't have anybody who was on active therapy. So if we had folks that weren't comfortable, they had the option of doing virtual camp at that point. So that was kind of the programs that we did last year.
Okay, thank you.
And it worked, families were happy just to have anything.
Corinne, why don't we go ahead and since you were just talking, we'll continue on with you. And what kind of factors do you consider when you're thinking about whether you're going to hold camp again this year, or whether or not you'd have to not hold camp?
Right. So as everybody knows, Washington State, we were early COVID adopters. We were patient zero here. So we've been doing this for a long time. So I think the main factor that we're going to be looking at, and, last year remember back, every 6 to 9 months or so, we have like 3 weeks that are the good old days. So last year, when we were looking at factors with it, we were looking at really rapidly decreasing numbers, really rapidly increasing vaccine rates. And we hadn't even heard of Delta or Omicron at that point. So the factors that we're going to be looking at this year, right now, we are anticipating that, we're hopeful that we're getting more somewhere. If there's a word, I want to invent a word between pandemic and endemic. So, that we get into the somewhere in the in-between points. We'll make sure that our numbers are low. And then the other factors are just the availability of vaccines. And we're just going to mandate that everybody that comes to camp be vaccinated. So looking at numbers, looking at the CDC recommendations, looking at mandating that people are vaccinated, including staff, and going back to in-person children only sleepaway camp. And then doing the testing. And, we're still a little bit flexible as to what the testing is going to look like. We're exploring different things, but we are going to have everybody tested. And we haven't quite nailed down whether or not we're going to do the what we thought so far is that we were going to do 72-hour PCR testing for staff in case somebody tests positive and we need to float another staff member into the camp. It'd be nice to have more than just, the couple of hours before. And then for campers doing the antigen testing immediately prior.
Thanks. And Mark, how about you in terms of, looking at the things that, not even just the day before, but things ahead of time that would help you decide whether you're a go, no go for camp?
I really can't imagine a situation after having lived through the past 2 years in which we would not open this year. Day camp has challenges that are separate. Some are easy. Some things are easier for us. Some things are more difficult than for an overnight camp. It's, for us, screening is just so impractical. We have people coming and going every day. The idea, I think that we did symptomatic screens for all the campers every day before they got onto the bus. But I just can't imagine not opening outside of some total disaster. I think it's a question of, we learned last year that we can do what we need to do and keep everybody safe with cohorting, with screenings, with, we canceled, like I said, we had to cancel some individual days where our indoor facilities were insufficient for the or sometimes we had like half the campers come one day and half the campers come another day if we had 2 rainy days where our indoor facilities were insufficient for social distancing. 2 summers ago, we did the virtual camp in a box, and it was very well appreciated, but it's just not the same. And we all know that. That's why we exist. So I think it's a question of just, we're going to all the staff will be vaccinated. I think our organization is looking into the question of whether or not if the vaccines for the younger kids are still under emergency use authorizations and not yet quite FDA approved, whether or not we are going to feel comfortable mandating vaccines for the children. But I don't see us not opening. It's a question of how strict whether we loosen up some of what we did last year, whether we keep it the same. But I think that we demonstrated that we could do it, because we had, at our busiest camp where we have 700 registered campers and roughly 350 coming every day, but they're different kids every day. We had no nosocomial COVID.
Great, thanks. And Susie, what about you from an overnight perspective too?
There are a lot of the things that we're looking at are already been addressed. I think, as Dr. Atlas said, I think we're really trying to move into that feeling of we're in an endemic and we have to learn how to live with this. And we really feel comfortable with the safety strategies. And if we do them well, we feel like we can keep the campers safe. I think the most important thing is in keeping them safe, you have to recognize you still may have COVID at camp, but it's how you manage that COVID case that's really important. So it's the things that you do to recognize symptoms early and get that camper isolated that I think is really important to mitigating the risk in a widespread outbreak. And so, I think having those good strategies in place, I think, are really important, as well as all of the preventative ones. I think the other thing that we're looking at, so again, if we go into another big Omicron, that might make us a little more squeamish, but I think in general, our hope is to be together, starting with our late spring programs through our summer programs and the rest of the year. I think the other thing that we are looking at too is the ability to be outdoors as much as possible. I think that's been demonstrated that being outdoors is really critical. Staying out of those closed-in spaces is actually beneficial. That was one of our challenges that we had with some of our winter programs, and why we elected to stay virtual this winter is just we couldn't predict that we could be outdoors. And I'm glad we made those decisions, because Omicron did hit. So I think keeping outdoors, we had our medical office outdoors, which was actually quite lovely. I actually got to see outside this year at camp and got to be on beautiful Lake Geneva. Our medical office just opened up to this gorgeous lake, and it was fantastic. So I think we're anticipating doing that, all that same thing again. We ate outdoors. We had big tents put up all over campus. So we fortunately had beautiful weather during the week that we were together. So everything kind of turned out well this last year. So all those things will be the same. I think the other thing is, I think you have to think about whether or not you're going to have enough staff to cover whatever you're doing, 1 week, 2 weeks, 4 weeks. So we didn't make any promises to our families, and we won't this year. I mean, we will still continue to let them know that the number of campers that we can take safely will be dependent on the staffing levels that we get, and encouraging them to get all their documents in as early as possible. So I think that's something to think about, is that you may not be able to have the same numbers that you had in previous years, and that's okay. We actually did not end up turning anybody away, but we had lower levels than we've had in the past. And I think that was comfort with coming back together.
Great, thank you.
So a couple of you mentioned vaccines. I wanted to clarify, when you say vaccines, do you include boosters in that for anyone who's recommended to have it? And then there was a little bit of a piggyback question on that for from the chat. For camps that are planning to mandate vaccines, what about families that are claiming medical exemption or don't want to vaccinate? And will you allow them to attend? Corey, you started to answer in the chat, so how about if we start with you?
Yeah, I am taking the hard stance that if you are choosing not to vaccinate, then you can choose another camp. I am mandating. I think that we have all seen how safe the vaccines are, and the only medical exemption that we have seen so far of kids who have been allergic to pegasparaginase and the polyethyl glycol content with it. And there have been no kids so far that have failed even a we call it the Miralax challenge with the polyethyl glycol. So the medical exemption is pretty, it's an eye of a needle as far as I'm concerned. It's pretty small. So I think that we could think about that in 2023, but for 2022, I'm going to mandate everybody to come to camp, including staff, to be vaccinated.
Does that include booster for you?
What we're going to do is, and we've been bouncing that around, and I think it's going to depend on whether or not we've got what we kind of consider another surge. So what we were thinking that we were going to do is mandate at least the 2 vaccines and then strongly recommend a booster. However, if we get into another surge, but it's sort of not quite at the point where we had got to with Omicron, then we may reconsider that. And we're going to message it that way, especially for staff, of just saying we strongly recommend, and we may end up mandating it if we get closer to the time period and it looks like we may need to, that the CDC or science dictates that the boosters would be something that would be most helpful in protecting our population.
And then just to add, and someone has asked in the chat, would you say that vaccinated is the 1 J&J vaccine? Or are you going to require 2 vaccines for everyone?
So far CDC says 1 J&J vaccine. So I think we just follow what the recommendations are. If it looks like it wanes, like even more so than it does, but yeah, I think that we just, follow the recommendations. And so far it's just been 1 J&J, and I highly recommend a booster.
Okay. Susie, how about for your camp?
Sure, we're going to require vaccines for campers and staff. We are going to require boosters. So I think the CDC defines fully vaccinated as being your initial series, and then up to date being your booster. And we're going to follow the up to date recommendations. I did send a nice link to the CDC. They have a nice table on their website. So Ryan, if you can put that link in the chat, that would be great. So that's our plan. We kind of did a soft launch of that because we were going to do a winter camp in person, and then we pulled the plug. So of our, I think, 70 some campers that had actually applied, we had about 5 kids right away, or 5 families right away, reach out wanting to know about exemptions. We are going to, at this point, recognize medical exemptions, but as Corey said, there's a very window of medical exemptions. And so, I know there's some of the families that reached out were already trying to, my child had some heart issues back when they were on treatment, and therefore I don't want them to get the vaccine. But, we are going to be fairly, strict with the CDC recommendations and go with that. So at this point, though, boosters are recommended, I think, only for 12 on up, I believe is what the chart says. So it'll be the 2-shot series of the Moderna Pfizer, plus a booster if you're more than 5 months from your original series. And then for J&J, the recommendation is a second shot 2 months after the initial. So that would be our recommendations there. We're kind of worried about our 5 to 11-year-old group, and whether or not, especially that 5 to 10-year-old group, whether or not we're going to see a big drop off because of vaccination. It'll be interesting.
And Mark, how about for your camp?
For staff, what I'm calling optimally vaccinated, which includes the booster. For our campers, we're going to encourage optimally. I think, you know, with the 5 to 11-year-olds, the vaccine has just become so that we don't have any. Nobody's actually at the point where they really require boosters, and J&J is not licensed for that group. So we'll see what happens as we get closer to camp. But like I said, we're still immersed in the question of, you know, of whether we're going to mandate it for the campers or we're just going to highly encourage it. But if we're one way or the other, it'll be optimally vaccinated.
Dr. K, I think the other confusing, and there is that recommendation in immunocompromised patients for even a 4th shot, especially those older kids who are not going to at this point require. I mean, we want them to discuss that with their oncologist and determine if that additional vaccine is recommended, that additional booster, before they come off to camp. The other thing we did last year, just as we're talking about the oncology team, because they're really critical in helping these kids on therapy, their families determine whether or not camp is a good place for them to be. And, you know, there's a lot of factors that play into that when a child's on treatment. So we did create a letter last year to the healthcare professional that describes kind of how we were going to keep kids safe at camp, and talk to each family camper on therapy, and really encourage that dialogue to occur between the medical teams and the parent. And then we also sent that letter out to our referral sources so that they could at least have an idea of what we were going to do. I was trying to find that letter today for Ryan to share out to the group. I could not locate it, but I will find that and share it if anybody's interested in it.
And I'm going to throw on, would you make an exception for a camper who wasn't vaccinated but had Evusheld? Would you allow them to come?
Yeah, we haven't actually had that discussion yet. It's one of the things that I want to discuss with my medical team, and we just haven't. We've had some other things we've discussed. I haven't got to that yet.
How about Corey or Mark? Have you addressed the Evusheld question yet?
We haven't. My feeling is I would probably allow them to come with sufficient screening, and we need to figure out the timing of where of if the Evusheld were 2.5 months before camp, do they need to get a vaccine at a certain point? We're a 6-week duration, so things change.
We haven't talked about that in our camp yet either, so I was just curious if any of the 3 of you had addressed that yet.
Great. Go ahead.
I was going to say, I think we've addressed, but I don't know that we've kind of come down on it. I know that in talking to some of our staff, and Jennifer and I got a little distracted as well, because Jennifer from Make a Dream and I were kind of back and forth with the mandate piece to it. But I think part of it too is each state is a little bit different. So we definitely have rules that our camp staff, so our camp director has been trying to follow. I'm not sure if every state has their own camping guidelines, but Washington State does for like holding in-person camps.
Now, New York State did too, and last year they changed weekly between the end of April and the middle of June.
Right. Yeah, I know. And that's just it. There's so much of what we're trying to decide right now for even the end of June that feels like a moving target, because, I think back to 6 months ago and how different things were. So thinking 6 months in the future, it's hard to kind of pin down exactly what we're going to be doing.
Flexibility is key.
Mhm.
and having, you basically, we had algorithms, and especially because we have 3 camps in New York, 1 in Maryland, 1 in Atlanta, which, and, the epidemiology in those different locations was different as well. So yes, flexibility is key.
Just to add on to that for a quick second, I think the questions that Jennifer was raising was, would you feel any different about running your camp if you were not allowed to mandate vaccines? Because there are some states now, and as we said, every state has different things, but there are some states who have been saying that people can't mandate. So I'm just curious if there's anyone who would say that's a no-go for them.
Well, I kind of struggle a little with allowing us not to mandate. So businesses are allowed flexibility, and I couldn't imagine, so it's different for schools or hospitals or corporations, but for a free volunteer camp for kids with cancer, I couldn't imagine the state pushing back on saying that we needed to mandate. I've been camp director at Good Times for 10 years, and I mandated, I've done mandatory vaccines and have made plenty of families angry, but we have mandatory vaccines in a state that doesn't love mandatory vaccines. So again, if they want to choose to not vaccinate, they can choose to go to another camp.
Yeah. It seems like from what she's been saying that the state that she's in is not allowing any exceptions to that. So unfortunately, that may just be a specific to her. But let's go ahead and move on, and we can always come back to that at the end if we still have issues for it. But so we talked a little bit. Each of you talked a little bit about your testing strategies, about testing before camp, and then also we didn't really talk too much about testing during camp, if that was something that you would be potentially doing. So we were just wondering, what are you going to test? If so, what kinds of tests are you going to use, and how often are you planning on doing it? So why don't we start with Mark this time?
So for me, for the day camps, the logistics of screening are impossible. We have too many kids. They're coming, they're going. What does the screening even mean when they're going home to everything? So I'm going based on symptoms. And if a child has any symptoms, then they must be tested prior to returning to camp. And that's how we did it. And same for staff. Our staff last year were asked to basically take a binding pledge to avoid mega spreader events, and actually their contract said that they could be terminated if it were determined that they had attended it. But we're basically going to be testing based upon symptoms only. I'm not doing screenings.
Susie, how about you?
Sure. So we're going to do a combination of tests, and it depends on the program that we're running. For our residential camp, we are planning to do the PCR around the 3-day mark, like Corey had mentioned, prior to camp. We actually do a rapid antigen on arrival prior to the camper even getting out of the car and stepping foot on campus. We use an off-site high school that's up the road and do that staggered check-in, which has actually worked out really great last year. And then if everything looks good there, then they move on to campus. We did do an end of camp test last summer. Just again, we're early on in putting all these different strategies in place. And it was one way to, first of all, ensure that we had a successful camp with no positive cases. But second, it allows us to know that when kids left camp, everybody was negative. So if somebody comes down with COVID 48 hours later, 72 hours later, you may not have to do, or like 72 hours, your full contact tracing. So we are probably going to do that at the end of the week as well, just to kind of close out the week. The kids did not seem to mind the testing. We also are going to use a test to stay strategy. So if a cohort has somebody who is positive for COVID, and that camper goes home because they're positive for COVID, then we would do a test to stay for the rest of the cohort, trying to capture any positive cases very early, and that would be a rapid antigen. We are going to do some one-day programs, and for those programs, we are going to use the Lucera, the NAT test. It's a molecular type test. It tests out rapid in about anywhere from 15 to 30 minutes. And so that's our plan for that. I do want to put a plug for screening. I mean, I obviously don't have the numbers like Dr. Atlas does. There's no way I can test or screen the number of kids he's talking about. We're talking about much smaller numbers, but our health screening was extremely successful last year. We did 10 days pre-camp. This year we're doing 5 days pre-camp, but looking back over the 10-day period, we were able to identify about a handful of people that really shouldn't be coming to camp that might otherwise have come to camp with those mild URI symptoms or whatever. And as a result, we started the camp healthy, and that was amazing. And we didn't have really any of the other respiratory stuff that we typically would see. So I'm an advocate for the health screening. We worked with a company. It was really slick. It took about 30 seconds to complete online every day, or through your text, and that really worked well. We also did do daily screening on campus, and that also did pick up not a COVID case, but did pick up a few other things that were, we had a GI bug, and some other things that were picked up pretty early on with kids. So during the course of camp, we sent a counselor home and a camper home due to other health issues that would have been potentially contagious.
Thank you. And how about you, Karen?
Yeah, we are going to do the rapid antigen prior to the campers coming. We'll probably have 100 to 125. There were a couple of strategies. Again, we're still a little bit of a work in progress. There were a couple of strategies that we were thinking that we were going to employ. We're pretty isolated where we are. We're on Vashon Island, and we're in an area that is not, we don't have like Dr. Atlas and the campers that are coming and going. We have in the past had staff that have come and gone off, basically off the camp site. So what we were thinking that we were probably going to do is basically sort of have camp as a lockdown, so that we don't have anybody coming and going, that we'll test everybody beforehand, and then we don't allow folks to come and go. We weren't thinking of doing like day 3 or 5 rapid testing. What we were going to do was daily screening, kind of like what Susie spoke to. So we were going to have our cabins in pods assigned to the nurses, and that we would do daily morning screenings of symptoms of everybody. And then, break down the stats to the pods as well. And, I'm sure everybody who works at a hospital is doing the same thing. Like we've got a daily screen that we do kind of online, and we were thinking about having at least the staff do that, like finding some sort of ours, I think it's just through Microsoft, and it's a, document that you do and submit every day, and have staff do that. And then, like Susie, we were going to have our nursing med shed moved outside, and before going to meals, depending on what that's going to look like, we would do the daily screenings and, just try to nip things very quickly if we did have anybody who had symptoms.
A couple other comments on the rapid antigen. So with our staggered kind of drive-through check-in process that we did, knowing that we were doing the rapid antigen testing and that was going to tie up our medical staff last year, what we actually did is we worked with our local chapter of the Hematology Oncology Nursing Association. So our Wisconsin chapter, you could look at nursing students, you could look at other sorts of organizations, but we had about 6 of those nurses that came in, and they really ran our rapid antigen testing for us. So the other nurses could actually focus on doing the medical check-in while the camper family was sitting there waiting to get their test results back. And so we really utilized that time well. It worked extremely efficiently, and it also met the philanthropy obligation that our local chapters for APON do need to, or APHON now, do have to meet. So that's something to think about when you're looking at expanding or looking to try how am I going to fill that gap and how am I going to manage all this on opening day if you elect to do rapid antigen testing. And I think the other thing that's important with all of these strategies is that there's not one approach to fit all. You really have to look at your camp, your volunteers, your campers, what types of campers, how much on therapy. You really have to find the right fit for you. And I really want to emphasize that there is no right or wrong. And there can be a lot of different approaches to do this very successfully. And regardless of what you do, regardless of what approaches you do, regardless of how many days you meet, regardless of what your program looks like, you are going to make a lot of kids happy this year. And I think the mental health for these kids coming back together, that connection, Dr. Atlas talked about that earlier, that connection is so important right now when mental health issues in kids are at an escalating, an all-time high. So regardless of what you do, it's going to be great. And whether or not you decide to stay virtual, that's going to be okay too. It's bringing kids together. It's making things happen for these kids. It's truly, whatever you do is going to be wonderful.
Great, thank you. And I love the idea of bringing in nursing students and stuff to do it. It's awesome.
Well, speaking of testing, I know that'll take additional supplies, but what other additional medical supplies do you guys think you will need to be able to run your camps this year? I'll let whoever wants to answer go first.
Did a lot of PPE. So because of the testing strategies, we went through a lot of gowns, a lot of gloves. I had to do an Amazon order midway through the week. And gloves were not so easy to get at that point in time. I thought I had anticipated supplies well, but I did not anticipate enough gloves. I think we had little housekeeping cleaning kits and disinfecting kits out to each cabin. Those had gloves in it. So gloves were huge. Hand sanitizer, hand soap. We rented extra sinks to put up in key areas around campus so that the thought of hand washing was ever present on everybody's mind. We also, because we were outdoors more, we went through a lot more sunscreen and bug spray. So if you have some donors for that, I think that's really important. And then as we talked, we had a lot of tents up because we were outdoors. We needed to have shade for the kids. And so we had tents by the waterfront. We had tents in the fields. We had tents everywhere. So there was a lot of additional expenses for some of those things. So that's kind of what I saw as increased needs.
We had mostly PPE. Purell, we had Purell taped to trees all along the way. It was just, pretty. I kind of wish we had one of those big like slides that went into a huge little pool filled with Purell, except that we worry about people doing that with low platelets. However, that was really it. Some of our camps had the need for extra shade structures. Many of ours already have a lot of shade structures because we're primarily outdoors, except in inclement weather. But those were our major things as well.
Yeah, I feel like I'm getting sort of a little extra bonus ideas for our camp coming up this year, since we didn't really do one last year. So thanks to everybody for all of the extra ideas. I think when we were thinking about what we would sort of be lacking in this year is just, we are a pretty tight camp, and we try to accommodate as many campers as we can. And we would really have to carve out, if we had somebody that needed to go into isolation, that was the only thing that we were thinking about. It would probably carve out a space, including a bathroom, that would make it so that if we needed to keep that open for an isolation space, it would probably make it so that 2 to 3 staff members would have to find another place to stay. So I think that was our biggest thing that we were thinking of, is just kind of coming up with an isolation space. But also, Susie, I appreciate the farming out the antigen testing. We're looking into that as well. So I know that Cooper, our camp director, has been looking into, obviously it's a business opportunity. There's consulting services in Washington State that will do that. So she's been looking into that. And as well, there's a well-organized volunteer group apparently on Vashon Island that we've been looking into that basically kind of does events in schools all the time, and it's all volunteers. So we're looking into them kind of staffing a parking lot away from camp as well and doing the antigen testing prior to the families coming in.
We worked with Heed Healthcare, which is out of the East, New York, New Jersey, and we are going to continue working with them this year. I think the thing to remember, whatever testing you do, there are state requirements for reporting those tests. And there's CLIA, you have to have a CLIA waiver, which I think a lot of us do already for other tests that we do on campus. But you do need to have that CLIA waiver in order to be exempt from all the other CLIA stuff. But the nice thing that he did for us, they had the nice screening tool, plus they worked with the lab already. And so they took care of getting all the kits to the campers and all that kind of stuff. You know, it was costly. I'm not going to say that. It cost some money. But it took a lot of that onus off of me and allowed me to continue to focus on the camper needs and what we needed to do to keep them healthy and safe and address all of their oncology related needs. And so I think there's a lot more out there. They're very competitive. They're offering more and more. So I would anticipate that maybe cost of that could be a little bit better this year as there's more competition. So worth looking at, but just remember, if you are testing, you need to look at your state requirements for reporting.
I wanted to ask a question that popped up in the chat for our panelists. Do any of you work with buses or have buses bring kids to camp? And how do you address that for screening and testing, et cetera?
Oh, I'll take that one. Busing is our number one budget item. We have so many buses where, and on these routes, we reduced the number of children per bus. Where we used to use mini buses, we chose to have the large school buses with the same number of kids in them, so we could, keep them pretty much one child to a seat, windows open. They had to have their screening done, their daily screening done prior to getting onto the bus. So I mean, I think if it's a sleepaway camp, you could make sure that they have, sort of like going to the airport. You could have a report or something before you get on the bus of whatever recent thing, or they would have to have, or you have a list. And for us, it was a challenge because coming on a daily basis, we had our cohorts in camp, but we couldn't have cohorts in camp and the same as the bus cohorts because they all come from different places and they're different ages. So we had to keep two separate logs of, because each kid was effectively in two cohorts and there was some potential cross-contamination. But surprisingly, it went extraordinarily well. One of the challenges also was last year was that many of the bus companies did not require the bus drivers to be vaccinated or to at least report their vaccination statuses. And so that's another thing to keep in mind when if you're discussing busing is what the bus company is willing to do as far as the bus drivers and how far you're going to keep children away from the bus drivers if you don't know what their status is. But it required the basic thing. It's always a nightmare, but it ended up working out okay.
We typically bus, however, and so we have a mix of people coming either via family car or bus. The problem is we bus from Green Bay, Wisconsin, Milwaukee, Wisconsin, Chicago, Illinois, and that would, in order to do the testing strategies, that would have meant that I needed testers at all three locations. And again, I was worried about my staffing abilities and the ability to really manage that, not knowing how that was going to look. And so we actually let families know that there would not be buses. And that we would work with anybody individually who needed to get a ride to camp. We actually had 2 families who couldn't get to camp. We Ubered them with the parent so that they could go through the check-in process with them and then Ubered them home. So we had very few families who said, I can't get my kid to camp. And it worked out very well. I think we're going to do the same thing again this year. We're still talking about whether or not we offer a bus home because we don't have that testing piece on there. But I don't know that I would have the volunteers and the medical to ride the bus because they will have all driven up to camp. So we might have to look at hiring people to actually ride the bus if we decide to do that. But right now our plan is to go with family transportation and working on one-on-one with families who really need that additional assistance.
So I feel like I owe you a check, Susie, for segueing perfectly onto the next topic. So the next topic is, while you're talking about staffing, is if you guys are worried at all about being able to get enough medical staff for your camps, and if your needs have been greatened because of needing to have people assigned to cohorts and things like that. And if you have any novel suggestions for that. Why don't we start with Corin?
Yeah, given the current situation and how, much people have been working and how, healthcare workers feel kind of at the front line with stuff, I think everybody's excited about camp, but I'm not sure how we're going to do staffing wise with it. We're either going to have a flood of people, or people are just stretched so far. We're not. Our volunteer applications open up on March 1st. So I'll keep everybody posted as to how we're doing. I don't think that we're going to need anybody more than what we have. We generally staff anywhere from 6 to 8 nurses and a provider, generally a nurse practitioner. And I think with the cohorts that we have, we will be able to manage the extra screening and the testing piece to it prior. I think is going to be the biggest. I think the testing prior to, kind of, as Susie had pointed out, was going to be the most challenging piece to it. And I think that we're going to, pretty much push for having an organization or, help with a volunteer organization doing that for us. I think once we get into camp and everybody is settled, I think that we're just going to have the normal amount of staff. We haven't done it yet, so I may be naive about that, but that's so far kind of where we're at. And of course, that's going to be kind of contingent again on what June and July looks like.
Great, thanks. Mark, how about you? Mark, you're muted.
I'm sorry. That's why I'm always bad about muting. Thank you. We getting enough nurses to staff every single day can be a challenge for us, even in a regular year. And it was a little bit of a challenge last year. We had some days where we were flush and other days when we weren't. We tried to have we increased our cohort by 1 nurse over the previous years, anticipating that there were going to be more questions and challenges. So we're trying to deal with that early. Our nurses are paid, but they're really not that we could. We might want to. I think that one of our challenges is I think we might need to increase the remuneration for our nurses. And then from my point of view, it was a lot more work than it ever had been any year prior, because there were so many clarifications and questions, etc. there that I was getting. Once we got 2 weeks into camp, everybody got the flow got there, and everybody felt comfortable with the algorithms for what to do. But those first 2 weeks required a lot of guidance. And it was appropriate. It was all appropriate questions.
No, it just makes me laugh because I think of those that have 1 week camps, and if it's going to take 2 weeks to get up to speed, we're screwed.
they're different models. That's the thing. I think, it's so by the time, I think hopefully the overnight camps, once you get through the first day, I think it's going to be a lot easier. For us, it's just it's sort of like Groundhog Day for the first 2 weeks.
Yeah, no, I'm just teasing because there's some years that I feel like by Friday, the last day of camp, I got it down. We finally are ready. So everything's good. Susie, how about you?
I actually want to comment. I think what Mark has said is just that you have to be flexible, that you can have the best laid plans, but you get to camp and you start going and that best laid plan may not actually work. And so you just have to be willing to kind of adjust as you go. From a staffing perspective, we decentralized our medical coverage about 15 years ago or so. So what that basically means is that we actually had multiple nurses or doctors in each program, kind of working alongside the kids out with their activities and things like that. And so moving over into a cohort base, we just provided, one nurse to each, or we had physicians in there too, to each small cohort to kind of manage the care needs. So we were able to do it last year. We had we only asked for 2.5 days or 3 days of commitment from everybody. And so it was a little bit easier than coming back to say, okay, now we're going to run 2 1-week camps this year. So I am a little worried. I'm a little worried because I think a lot of people have postponed weddings. I think a lot of people have postponed family vacations, family reunions. I think funerals have been postponed, celebrations of life. I have had a lot of nurses who have actually gone into the traveling nurse world, and I don't know where they're going to be when July hits. They all say we want to come back to camp, but I don't know where they're going to be in their contract. So, I want to be able to get some soft dates out there so I can start doing some soft recruiting before our formal applications open. That's what I've been doing with our sibling camp, which is in June. And we'll kind of see how it plays out. If we can't get enough staff for each cohort, then we go back into a more centralized model. And that I definitely think that we will be able to meet those needs. But I do think a lot of our nurses, or a lot of our healthcare team members are stressed with what they've been dealing with over the last 2.5 years. And they also just may need personal self-care time versus coming to camp, even though I think camp does rejuvenate them.
If you haven't had a chance, everyone, please take a look in the chat. There's lots of great conversations and questions in there. If we don't get to all of them, we will ask our presenters to respond to any questions that came up that didn't get addressed. I'm going to take the opportunity to throw out a question that I told the presenters I was going to ask, which is there anything you did last year that you thought was going to be great that just didn't pan out like you thought, and you would say, I'll save you the trouble, don't try that this year? So maybe what was your hardest lesson learned from the camps that you've already done?
So our hardest lesson was not a programming lesson. It was a counselor lesson in them maintaining their leadership roles and using PPE appropriately and abiding by our guidelines. Because our guidelines said last year, whether they were conservative or not can be debated, was that when kids were traveling in groups throughout the camp, because they were to be masked and the counselors were to be masked. And we found a lot of our counselors were slacking on it. They were doing the beard masks and stuff like that. And they just felt like, okay, we've been through this. It's not going to happen. It's not real. We're not at risk anymore. And they felt that they knew better. And then Delta came. And so we are really going to be, what we're doing is we're really, when we're hiring our counselors, we're driving it into them that's a reason for termination. If they don't want to wear their mask, don't accept this job. And I think that really, because it filters down to the kids. If their counselor's not doing it, why are the kids going to do it? So that was one of our major lessons.
The weakest link, right? That's what Dr. Atlas said, the weakest link. Everybody said the campers will do anything that people who went back in 2020 said, the kids will do anything you ask them, watch your counselors. And again, that was where a lot of the emphasis had to be. There were a couple things that we aren't going to do again this year. We had some confusion in our mask policy, and I actually didn't want masks outdoors, but the rest of my medical planning team wanted masks outdoors. And so this year we're getting rid of them. I mean, last year, most of the kids wore the masks all the time last year. It was crazy. I mean, you could look at most of our pictures and they all had masks on and they were smiling behind those masks, but it was a very confusing policy. The other thing that we did was we did box lunches for meals. And I think we really threw our kitchen, we rent. And so our whole kitchen staff got thrown off to the point where we had boxes that were supposed to be for gluten-free that had gluten in them. And, I mean, we were fortunate that we caught that really early and were able to reconcile that. But I think when we start asking some of our kitchen places to start making lots of changes, I just keep a really close eye on your meal times and what the kids are actually getting.
Corey, thoughts?
Yeah, since we did kind of the family pod piece to it, I don't think there was anything that was lesson learned with it. I honestly, I think the only lesson we learned is that everybody's tired of virtual camp. But yeah, no, I don't think we had any lessons or medical lessons that I could speak to right now. Ask me this time next year.
And just to round out, did any of the three of our panelists, did you have any positive cases during your camps last year? And if so, how did you isolate them? So Corey's got a no. Good. Wonderful.
Yeah, no, but I would, piggybacking on this, we've been meeting almost weekly with our group about camp moving forward. And so I would be curious to hear if people feel like if you did have a positive camper midway through camp, especially who was symptomatic, what would you do with the other than isolating them and sending them home? Obviously, what would you do with the rest of camp?
Well, and then the question comes up is, what if you have a camper who lives a distance away or flew in from somewhere, and how do you get them home? Susie, I apologize. I didn't mean to interrupt.
No, that's okay. Our plan last year was to send the whole cohort home. This year, we're going to do the test to stay. So the camper who is positive for COVID will go home. The cohort will continue with activity as long as the family and camper, the parent and camper elect into it. We'll do a daily, probably antigen test, do a test to stay program similar to some schools have done, which has been shown to be beneficial. Again, trying to identify another positive case very early on. Hopefully, the positive test will come up later in camp and you'll be ready to send the kids home before then. Now, Ryan has 4 to 6 weeks of camp, so that's not going to happen for him. So I guess we do have some kids that fly distance. I guess that's a good question, Dr. K. I think we haven't really talked about that. We have a few kids who do fly in, but most of our kids are able to travel via car. And so I think we had in our guidelines for the parents pre-camp was that they would need to pick up the camper in 4 to 6 hours, but obviously that's flexible if we needed to flex that. We are just currently undergoing some changes in our safety strategies. We're expanding our cohort numbers this year and a few other things, and I'm happy to share those with anybody who would like them if once they're actually updated and finalized.
Mark, did you have any positive cases?
We didn't have any. We had, I think, one positive case, but it's easy for us. We aside from for us, the contact tracing is the challenging part, but the isolation is easy. They go home and they stay home until they've recovered. It says the contact tracing, but we had I think one camp that had one positive patient, but we had no nosocomial.
We are coming up to the end of our hour. I want to be respectful of everyone's times. Again, please check the chat. There's lots of great resources and thoughts being shared in there. And then a couple of questions that we didn't get to, we will ask our presenters to answer and send out in an email. Ryan, Jennifer, anything you want to add?
So I think based on the conversation tonight, it's clear that we can talk about this forever. So I think I speak for Jennifer when I say that we will be hosting a medical director open forum at a later date so that all of our medical folks can get together and have a conversation with each other about these policies. But thank you to our speakers. Thank you for everyone who came tonight. Don't miss next week's town hall. It's going to be more about programming based. And we have a few medical town halls coming up about mental, emotional, social health of campers, as well as the outcomes of children with cancer who contract COVID-19. So be on the lookout for those at a future date.
Thank you, everyone, so much for joining.
Yeah, thank you, guys. Thank you to Susie and Mark and Corey. We appreciate you guys so much. Thank you.
Our pleasure. Thank you for organizing this.
Absolutely.
Thanks, everyone.
Best of luck to everybody as you make your plans.
Thanks.
Tammy, thank you so much for helping. It was nice to have a joint moderator, I think.
Ah,